Hello, my name is Amindeep, and today we're going to talk about inpatient and outpatient services. Healthcare services are divided into two main types, inpatient and outpatient services. Knowing the difference between them helps people understand how hospitals care for patients and manage their resources. Inpatient services are provided to patients who are admitted to a hospital and stay there for at least one night. These patients usually have serious illnesses or injuries that need close monitoring, surgery, or special treatment. During their stay, doctors, nurses, and other healthcare workers provide care around the clock. Examples of inpatient services include major surgeries, treatment for heart attacks, and childbirth that requires a hospital stay. On the other hand, outpatient services are medical services that do not require an overnight stay in the hospital. Patients receive treatment or testing and go home the same day. These services include regular doctor visits, blood tests, x-ray, vaccinations, physical therapy, and minor surgeries. And many healthcare services are now provided on an outpatient basis because medical technology has improved, making treatment safer and more convenient. Now let's talk about how inpatient days are calculated. So an inpatient day is a way hospitals count how many days patients stay in the hospital. One inpatient day means one patient staying in a hospital bed for one day. Hospital usually count the number of admitted patients at the same time every day, often at midnight. Each patient who is still admitted at that time counts as one inpatient day. Let's say, for example, if 40 patients stay in the hospital overnight on Monday, the hospital records 40 inpatient days for that day. If there are 45 patients staying overnight on Tuesday, the hospital records 45 inpatient days. So the total inpatient days for those 2 days would be 85, adding the number of patients staying each day. Hospitals can calculate the total inpatient days for a week, month, or year. Inpatient days are important because they help hospital measure how their services are being used. If the number of inpatient days is high, it means more patients are staying in the hospital and more beds, nurses, doctors, and medical supplies are needed. So if the number is low, the hospital may have extra beds and staff available. And they're also important for payment. Insurance companies and government healthcare programs often use the number of inpatient days and the type of treatment to decide how much money a hospital should receive. So keeping accurate records help hospitals receive the correct payment for the care they provide. Hospital also use inpatient days to plan for the future. They help managers decide how many staff members are needed, how many hospital beds should be available, and what medical supplies should be ordered. So this information is especially useful during busy times such as flu season or public health emergencies. Uh, Now let's discuss the significance of inpatient days. So inpatient days can help measure the quality of care. If patients stay much longer than expected, it may mean they have complication or recovery is taking longer. If patients leave too early, they may become sick again and need to return to the hospital. So, by monitoring inpatient days, hospitals can improve patient care and make sure people receive the right treatment at the right time. Thank you.